Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
And with me in the studio is Professor Dr. Hubert Mönnikes. He is Chief of Medical Department in the Martin Luther Hospital in Berlin. Hello, Professor Mönnikes.
Hello.
Welcome to the studio. Hi. Is this typical for IBS or the irritable bowel syndrome that the diagnosis can take so long?
Yes, unfortunately, this is the case. It takes very often quite some time until this diagnosis is really told to the patient.
But what makes this proper diagnosis so difficult?
The difficulty is that the regular tests, blood test, ultrasound, endoscopy, show normal results. They don't show any pathological findings.
So there's no finding that points you into the direction this is irritable bowel syndrome,
Exactly.
but you can just exclude some symptoms. Okay. But why is this exact diagnosis so important for the doctor and for the patient?
It's very important to give the patient the option to deal with this condition, to know what is my problem, why do I have symptoms, and what are the mechanisms behind of this. For this, you need this information also to treat it properly.
So for the doctor to choose the right treatment, and for the patient more to say, I'm sick, I don't make this up in my mind.
Right. Very often IBS patients were put in the category of faking a condition, of such psychological problems, and not the right diagnosis, IBS.
Okay. We got a viewer question from Kenya. Mr. Lukundu from Kenya wants to know, what are the typical signs and symptoms of IBS?
It's always a combination of symptoms. It's a combination of pain or discomfort. And in addition, patients have alteration of bowel function. This can be diarrhea on the one hand or constipation on the other side, or even a mixture of these conditions.
But symptom-wise, you can't distinguish IBS between other kinds of intestinal diseases.
Yeah, that's the problem. Very often you have no clear signs. If it's an inflammatory process, is it a tumor, or is it IBS? The symptoms are very similar.
Mm-hmm. And what are the known causes for irritable bowel syndrome?
Well, we know a lot about what is wrong with the function of the GI tract. We know there are alterations of motility, so the transport of the content of the intestines, the sensitivity, and also the permeability. But we don't know why does this occur.
Many patients in my office ask me if some gluten intolerance might contribute to IBS.
Well, these are two different diseases. This is celiac disease, this is the gluten intolerance, and IBS, gluten is not the reason for this condition.
Mm. And can make gluten intolerance in IBS even harder?
Well, some people describe that they have the feeling that if they eat gluten, their IBS symptoms get worse, but this is most likely more a question of perception.
Okay. And what about psychological factors like stress, feeling stressed out?
Yeah, this is a very important trigger factor. Since stress alters GI function, and in patients with IBS, the GI tract reacts more intense to this physiological reactions of the GI tract are more intense than in the normal person.
But it's more like a trigger factor. So stress can't induce an IBS or can be the singular cause of an IBS.
As far as we know from the studies we have in this respect, we know that stress alters the function, but it's not a single reason of IBS. You also need these alterations in the periphery to get this more intense reaction of the GI tract.
Professor Mönnikes, how successful is the treatment with probiotics?
Well, this is a very interesting option of treating patients with IBS, since it helps especially patients with perhaps not severe cause of IBS. It affects GI function, and therefore it can be very helpful in patients.
Okay, and might bacteria play a role in the cause of IBS?
Well, there are some results suggesting that it can play a role in altering GI function, and therefore it also can be a reason for IBS, but in fact we don't know enough right now to say, yes, this is a very important factor.
But it's important to stress out that irritable bowel syndrome is not an infection disease.
It's not an infection disease, definitely not.
Okay. And how do you treat IBS in general without probiotics, I mean?
Yeah, it depends very much on what kind of symptoms the patient has. If he has pain, if this is the main problem, you treat, for example, with spasmolytics. If he has diarrhea, perhaps medication that stops this diarrhea, and if it's constipation, you also have other factors. So it's a very specific treatment depending on the symptoms. It's very individualized.
Mm-hmm. And can you actually heal IBS with this kind of treatment?
Unfortunately not. As we know so far, it's a chronic condition, it's a chronic disease, and as long as we don't know why it develops, we can't cause the reason.
So you can just reduce the symptoms, and if you discontinue treatment,
the symptoms.
Okay. And so everybody has sometimes some tummy aches or some constipation or diarrhea in his life. So how can a patient distinguish between the normal things and an irritable bowel syndrome? When does a patient need to go and see the doctor?
Yeah. The difference is the severity of the symptoms, the frequency, and in the intensity. So these people have very often symptoms. They have high levels of disturbances by this, and they have a real the quality of life is really disturbed with these patients.
And it's longer going.
It's longer going. It's a chronic disease, not just a couple of days. It takes months and even longer.
Okay. We got a viewer question from Australia. Donny Bass wants to know, are there any new therapeutics at the horizon? Some new drugs or some methods we can put our hope to?
Well, yeah, there are some new compounds around, and they have different modes of action. There are some compounds which work more on the serotonergic system. We have compounds which affect the secretion of the bowel, and we have some approaches using antibiotics, and not probiotics, antibiotics to affect the function of the
So those are more broadband antibiotics?
Broadband antibiotics which but only work within the intestine.
Okay, so they're not...
they don't reach the circulation.
Right, okay, so it's a safe treatment option.
It's a quite safe treatment, right.
And what about psychological factors? I mean, stress can make IBS even harder, can't it?
Yeah, definitely. It's a very important trigger factor. In a subgroup of patients, this is perhaps the most important trigger factor. Patients know when stress plays a role in their symptoms, and then psychological intervention can be helpful.
Mm-hmm. And what about relaxation techniques or acupuncture and complementary alternative medicine? Does it play a role?
Yeah, we don't have so much data on acupuncture, actually. The data are not so promising. But the psychological interventions are very important. Relaxation training, for example, and also stress, to deal with the stress better, or even cognitive therapy is very often very helpful.
Okay. And is IBS dangerous? Can it lead to cancer?
Fortunately not. As we know, the life expectancy of patients with IBS is good. It's even a little bit better than in patients in healthy patients, since they are much better investigated.
So life expectancy is higher in IBS patients. What a very positive outview. Thank you so much for being with us in the studio, Professor Mönnikes.
My pleasure.
Thank you.